My name is Olivia. I'm a Future Youth representative, and I am here today with Rachel Mckenna from Gloucestershire Health and Care NHS Foundation Trust. We're going to be discussing a bit about sexual health, especially amongst young people.
Hi, Olivia. My name's Rachel Mckenna, and I'm a psychosexual therapist working at Hope House Integrated Sexual Health Services. And my job is working with people that have sexual difficulty. But previous to that, I was a sexual health and contraception nurse and health advisor for many years within the sexual health services. So it's great to be here. Thank you for inviting me.
No, thank you for letting me talk to you. So would you just please quickly be able to explain what sexual health is and why it's important to understand and take care of your own sexual health?
Absolutely. So sexual health is all about being human. Actually, it's an important part of being a human being. And sexual health is interesting because a lot of the time we're only ever taught about the physical aspects of sex and the risks associated. For example, maybe taught how to put a condom on to prevent a sexually transmitted infection. And not much of what we're taught is about the importance of the actual relationship between people. So it's very, very important to recognise that if the relationship is healthy, it's respectful, it's consensual, and there's honesty, trust, and openness, then the sex part will actually look after itself and it'll be really good. Okay. And the other thing that's really interesting to recognise is that often the only place that young people, old people, any age actually can go to learn about sex is using the internet or porn websites, for instance. And this only ever really shows the physical act of sexual intercourse, but not actually how to have an intimate and caring relationship with another person. Nor does it focus on pleasure and actually being ready for sex. Okay. The result can be that the sex isn't remotely what you imagined or expected. And sexual intimacy and pleasure, free from pain, infection, unplanned pregnancy, whilst being able to express your sexuality and be fully consensual, are the guiding kind of principles of sexual health. So the World Health Organization came up with a really good definition. I mean, it was a long time ago, but it's still relevant today. And they say that sexual health is the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. So I think that sums it up really well.
Super. So when do you think it would be a good idea to go to a sexual health clinic such as Hope House?
Okay, yeah. So Hope House works really hard to ensure that every aspect of sexual health is cared for physically and emotionally. So Hope House is a specialised confidential service that cares for people of all ages who have concerns about a range of issues related to sexual or reproductive health. Okay. We provide emergency contraception, for instance, to women of any age. And, people should come to us if they're worried about having an infection or they want to discuss a method of contraception, or, to have a simple sexual health screen if they've got a new partner or something. And also, you don't actually always need to come into the building. You can access the online testing from the Hope House website, which is www.hopehouse.nhs.uk. So it's really, really easy to access. So we provide contraception to women under 25 years of age. We also care for people living with HIV and those people that are worried about having or need treatment for a sexually transmitted infection. We've also got a pregnancy advisory service, which provides advice and support for women who've become pregnant and are considering having an abortion. And my department that I work in is psychosexual department, which helps people who are having difficulty with having sex. And then last but not least, we've got the Hope House Sexual Assault Referral Centre, or the SARC. And this department offers emotional and practical support, as well as medical care for anyone who's experienced sexual violence or sexual abuse. So Hope House is a really good place for anybody that, you know, has concerns, worries, you know, and just wants to access a specialised service to sort out their sexual health and contraception. Okay.
That's absolutely amazing. So how do Hope House differ from a GP, and how would you be able to make an appointment to go there?
Okay, so to make an appointment, you ring 0300 421 6500, and our telephone number is on our website. Okay, so consultations usually start with a telephone call. So the triage nurse or doctor can understand exactly what sort of care you might need, and then they can arrange the various type of appointment that you need. So that might be a follow-up telephone call. It might be a face-to-face appointment in person at Hope House, or one of our other clinics like at Cheltenham. Or it might be that you have a video consultation. So, you know, we do all those types of appointments. As I said before, there's also the online service for sexually transmitted infection testing. Okay. So we're a specialist service in genitourinary and contraceptive care. And all of our team are really highly trained in all aspects of sexual and contraceptive health. Whereas your GP is highly trained to look after the whole of your general health needs, not just specifically contraception. So they're general practitioners, which means that they are very skilled at what they do, whereas we focus in, you know, especially on sexual and reproductive health. Okay. Now, the other thing that's really helpful to know is that we are a standalone service. So we work independently away from GP practices and hospital trusts, etc. So that means that when you register or make an appointment, you're allocated your own unique identity code. And that means that if you have any tests done in the clinic, for instance, it's only your identity number and your date of birth that's actually contained on the samples. So people that are working in the laboratory would never know that, you know, a certain person has turned up to have a sexual health screen, for instance. So lots of people find this level of confidentiality is really helpful when dealing with sexual health concerns, because, you know, it is an intimate topic, and lots of people find it quite embarrassing. Okay, we're not embarrassed. We're very sensitive to people's needs, and we totally understand, you know, how awkward and difficult it can be sometimes to come and talk about your sexual health. So the website, which is www.hopehouse.nhs.uk, is really good, and there's a lot of really helpful information and also contact details there. So, you know, go and have a look, because you'll learn all sorts of things about contraception and STIs.
Consent, pleasure, and safety are all very important things in a sexual relationship. What advice do you have for young people who want to have a conversation about sex with a current or prospective partner? And how can someone ensure that they are emotionally and physically safe?
Okay. Talking about sex can often feel really awkward and embarrassing, whatever age you are. And the chances are that your partner is actually feeling exactly the same. In terms of consent and safety, being honest with yourself is a really good place to start. Really thinking about what you want to do, and most importantly, what you don't want to do. So, you know, being able to decide what you feel happy to consent to. And consent is not just about saying no, but also feeling able to say an enthusiastic yes. Okay. Taking the plunge to talk to your partner about what you feel ready to do is also a good way to keep yourself emotionally and physically safe. Sometimes rushing into being sexually intimate too quickly can lead to feelings of anxiety, distress, and being quite overwhelmed. And talking about what you want to do sexually before you actually do anything also allows time to arrange contraception, for example, and maybe get some free condoms from the distribution scheme or from Hope House, so that you're ready and prepared, you know, so that you don't have the added anxiety about unplanned pregnancy.
we're just going to have a quick chat now about contraception.
Uh-huh.
So in really basic, easy to understand terms, what is contraception?
Okay, so contraception is a safe and effective way of preventing an unplanned pregnancy. So if you think of the word conception, that means the start of a pregnancy. Okay, so if you add contra at the beginning of that word, and that gives you contraception, that means the prevention or the opposite of conception. Does that make sense?
Mm-hmm. Absolutely, yeah. Yeah, it feels like I'm in an English class, it's like taking all the words apart. So how does anyone, male or female, figure out what contraception is right for them? And are there certain forms better for certain scenarios?
So there's lots and lots of different types of contraception, and finding the one that suits you the best might mean that you have to swap and change around to begin with. Okay, I always think getting contraception is a bit like shoe shopping, really. You have to try on a few pairs until you find something that really fits.
Yeah.
So there's a whole range. As I said, you can have a pill that you swallow every day. There's also long-acting methods, which once they're put in, they can last anywhere from 12 weeks up to about 8 to 10 years. So, for example, the intrauterine copper contraception is put into the womb. So that's, your womb is where a baby would grow if you were pregnant. Okay. And the copper coil can last anywhere from 8 to 10 years. But there's also other intrauterine systems which can last from 3 to 5 years. You can have an implant that's inserted just under the skin of your upper arm. That lasts for about 3 years. And there's also an injection that can last up to 12 weeks. So lots and lots of different methods of contraception. And as I said, sometimes you have to switch around until you find something that you're really, really happy with. Mm. But the good thing is that the nurse or doctor or pharmacist that you speak to will be able to discuss your particular health and your options with you. So ultimately, it's your choice, and you decide on what is best for you and what will keep you safe.
That's great. So who should be involved in deciding what form of contraception is taken?
Yeah, good question, actually. So contraception is your choice, nobody else's. Your partner, your friends, your parents, your care or support workers, they can give you their advice, they can give you their opinion, but they're not you. They cannot decide for you. So once you've discussed your options, you decide.
That's great. So can somebody's medication that they're on or disability get in the way of contraception being effective, or close some certain doors which would normally be available to someone who doesn't have any of these regarding contraception?
So when your health professional discusses your options with you, they will assess any medication that might be causing you problems and then work out with you what available methods there are as an alternative. Okay. Sometimes disability, physical or learning disability, might mean that you need extra time to make the right choice. So Hope House is exactly the right place for you to support you. Okay. And we actually are very specialized at dealing with complicated. So lives for people are complicated and complex. And we've got some, a fabulous team of vulnerable access nurses who work with very, very vulnerable people, and we do a lot of work with under 25. So we're very specialised at dealing with assessing young people in a very safe and confidential way. So if there are disabilities or vulnerabilities, then Hope House is exactly the right place to support you.
If somebody thinks that their contraception has failed or it isn't working, which just isn't suiting them, what should they do?
Okay, so if you've had sex and you realise that your contraception has failed, or maybe you forgot to take it or use a condom, for instance, then get in touch with Hope House or a local pharmacy and ask for emergency contraception. in most cases, you've got a few days after unprotected sex to get the emergency contraception tablet or an emergency contraception coil fitted. But the sooner you get in touch, the better. Okay. And Hope House support women of any age in accessing emergency contraception. So ring in triage on 0300 421 6500, and talking to one of the team is really, really supportive in actually making sure you get the right advice and, within the timescales available, and then you'll get it sorted.
That's great. So thank you so much. I really hope everyone has enjoyed listening to this interview. It's been really interesting, enticing, and I really hope this has widened your perspectives. And would you just quickly be able to say the name of the website again for everyone at home?
So it's www.hopehouse.nhs.uk.
Great. Thank you very much.
Thank you.